Hello, everyone. Welcome to another episode of Weekly Hope. It's Kirsten here and Elsa, my little love, who always joins me. She's the unofficial co-host of this show. We are so glad that you found us, that you're here, and that you're joining us for the next 30 minutes or so here on Facebook Live. Before I welcome our guest, who is there on the other side of the screen, I'd like to tell you a little bit about what we are, what we do, and what this show is all about. So Weekly Hope is a Facebook Live interview series produced by Eating Disorder Hope, which is an online mental health resource hub for those who are struggling and their families and friends with an eating disorder and on their recovery journey. And we're here almost every week with different clinicians, professionals throughout the field of eating disorders, as well as authors, advocates, people with their own recovery stories. And I get a chance to interview them, talk with them. And of course, the big advantage of being able to do this on Facebook Live is, of course, being able to welcome you into the conversation. So we cover a different topic every week and love to hear from you. So throughout our conversation with Dr. Kim, this way. I just want you to feel free to pop in, say hello, say hi in the comments, let us know where you're signing in from. It's always fun to see where people are joining us from because we get viewers from all over the world. It's really cool. So let us know where you're signing in from. And if at any time you have a question, you've got a thought coming through your mind, Dr. Kim says something that really sparks your curiosity and you want to know more, please at any time feel free to ask your questions, because I'll tell you, sometimes we've had guests on here and we've had all this great material prepared and someone asks a really brilliant question and other people have follow-ups, and it just really gets to the heart of what you're concerned about. So we want to hear from you. So that's a little bit about what we do here at Eating Disorder Hope and about Weekly Hope. And without any further ado, then I'm going to introduce our guest and we will dive into our topic for this week. So Dr. Kim, welcome to the show.
Hi, thanks for having me.
Yeah, so Dr. Kim is joining us from Brooklyn, New York, and he is the National Director at Reasons Eating Disorder Center. So Dr. Norman completed his BA at Yale and his PhD at UCLA. He's developed an expertise in treating and teaching about psychiatrically complex populations and diagnostic assessment with a particular focus on eating disorders and anxiety. He's a regular national speaker, educator, and a passionate advocate for eating disorders awareness and legislation with a particular focus on marginalized communities. He's on the board of directors of the Eating Disorders Coalition and is the co-chair of the People of Color Subcommittee of IADEP, which is the International Association of Eating Disorders Professionals. That's a mouthful. Say that 5 times fast. And the Transcultural SIG for the Academy of Eating Disorders. Norman is the co-founder and national director of Reasons Eating Disorders Center. So, man, you have an impressive bio, sir.
I think it just means I'm old. I've done a lot because I'm old.
No, definitely not. No, it just underlines the fact that we're very glad to have you. And this is a topic that you're very passionate about. So we can't wait to hear your insight on this. But first, tell us a little bit about Reasons Eating Disorder Center and what you do there on a daily basis.
Sure. Reasons is actually in California, where I used to live. My wife and I moved to Brooklyn a few years ago and are fortunate enough to still be able to work and direct the program. But Reasons comprises inpatient, residential, partial, and intensive outpatient programs, all with a philosophy and a clinical approach that my wife and I, my wife is my co-director, along with our other founder, Lisa Arroyas, who's our Director of Nutrition Services and Director of Clinical Services. The three of us really had the opportunity to come up with program philosophy when we started Reasons, and have been able to develop it since then. But I think we're really proud. We serve, I think the people that we serve, which is a big part of so much of the work that I've been doing, are really representative of Los Angeles, which is a very diverse city. And because we're located in a psych hospital, at least our inpatient programs are, I think that also kind of necessarily changes the demographics of who ends up in our programs, which has been a big part of our push in this, in trying to educate people about the existence of eating disorders beyond what beyond the stereotypical groups that people think of as being affected by them.
Absolutely. And oh, we've got some people saying hi. Shauna McCrossan says hi, Kirsten and Dr. Kim. Love and light from Ireland. Thank you, Shauna, for joining us. It's so nice to see you. And then Deborah Schlesinger says hello from California. Hey, Deborah. So I'm curious what got you and it seems like your wife involved and interested in the field of eating disorders to begin with.
Yeah, I joke that I kind of found it in a both honestly and kind of randomly. I was in doing my work at UCLA. I was doing a lot of work in. I actually started off doing brain research on autism and Asperger's syndrome. But my primary clinical interest is in working with psychiatric illnesses that had a lot of medical components. So where the treatment took place in the context of a hospital setting. My mom was an OR nurse for most of my life. I literally grew up in hospitals and waiting rooms of hospitals. So it was always kind of a very sort of comfortable and normal environment for me to be in. And one of the rotations that I had in my training was an eating disorders unit. And then when I got my postdoc, it happened to be just down the hall from the eating disorders unit at UCLA, which was really renowned. And it was really kind of accidental. If it had been a different unit, I might have, gotten a start in a different field. But pretty quickly, something about the population really both interested me as an academic and researcher, but also I found a really deep level of connection with the patients with whom I was working. And I wasn't really ever able to put my finger on what that connection with it was. Just because I'm male, I'm not somebody who's struggled with an eating disorder personally, but there was something about it that felt very not familiar, but that I connected to quite easily. And I think it's a lot of what we're going to talk about today. There is this profound sense of shame that's a big part of eating disorders, and that certainly and unfortunately is a part of a lot of minorities experience in growing up as part of a minority group. And I think in those two things kind of coalesced for me as I got the experience of it in this coming from a very different place, but there's some core of the experience that I at least felt like I could understand,
Mm.
even though everyone's experience of any kind of illness, but certainly everyone's experience of an eating disorder is quite different and individual. But that was kind of where I was able to connect to it, was through shame and was through um, the understanding of anxiety. Um, when we talk to parents of people who have eating disorders, for example, I think they often find it very difficult to understand what their child is going through. And if I found that when you explain it through the lens of anxiety, all of us understand fear and anxiety.
Yeah.
And I think all of us understand shame. And when you put it in that framework, it becomes much more relatable and understandable for loved ones and family members who may not themselves have a personal history.
Yeah, absolutely. So fascinating. Thank you for sharing how you got into it. I think that story is so cool. So you mentioned shame, and as a root of or a way to start the conversation about how to think about eating disorders in the context of these marginalized communities. Everyone knows what shame feels like in here, but what exactly is shame? How is it different than guilt? How does it feel different than self-loathing? What is shame exactly?
Yeah, I think that's such an important question, and the way that you asked it is kind of the easiest place to start with which is kind of making the distinction between guilt and shame. So I think we tend to use those things interchangeably, but they're quite different from a psychological standpoint. Guilt is a sense of remorse about something you might have done, typically to somebody else. In other words, it's about the other, and it's about what having hurt somebody or wronged somebody. It's awareness. It's an awareness of having done something hurtful. Shame is it's by definition a painful feeling that arises out of a sense of how uh, how uh, th- some characteristic of yourself reflects on you. In other words, how others see you, independent of any action. It's something, for example, if I do something that hurts somebody else, I might feel guilty that I hurt them, but I would feel ashamed that I was the kind of person who could hurt somebody in the way that I think I might have heard it. I think that's the distinction. We're really hardwired for the capacity for shame because it served a really important purpose in our evolution. If you think about the fact that we're the apex predator, we're not the apex predator. We're not the one at the top of the food chain because we're the strongest or the fastest, because we're not. We got to the top of the food chain
Yeah.
because we developed the ability to work together in with other people, and um, one of the keys to working together cooperatively is the same thing that gives us the capacity for shame. If you don't have this sense of um, you know, if you don't have this sense of, if I do something transgressive, and if I do something that's really against what's good for the group or what's good for my clan, if you don't have that sense um, of shame, really, then it's actually hard to work together. Then you're kind of doing your own thing. You don't care what you might do to other
Mhm.
people. You don't care how it might reflect on you. And so we develop the capacity for shame as as something that goes part and parcel with our ability to work together in groups. And I think intuitively, we all probably understand that pretty well. If you think about people in your lives, or if you think about just people, public figures who appear to exist without shame, um, I think we all have an intuitive sense that that's a very empty existence, and it's a very lonely existence.
Yeah.
um, and without knowing anything of what I just said, I think you probably have some sense of that person as really existing in isolation, and they do.
Mm.
So shame serves a really important function. At the same time, just like with anxiety, anxiety serves a really important adaptive function for all of us.
Yeah.
But anxiety can also be harmful. It can take over at some point, as can shame. And I think eating disorders are a really poignant way that shame kind of takes somebody over and starts to sort of be the thing in the driver's seat to a really unhealthy and painful, degree.
Would you say, from all of your work and research, that would you go so far as to say that shame is really at the root of all eating disorders?
Yeah, absolutely. I mean, I've been working in this field for almost 20 years, and I can't think of a single patient I've had who, at their core, is not fundamentally struggling with shame. You can't have an eating disorder without this profound sense of, I think most people tend to think of it just as self esteem, and that certainly is a core element of an eating disorder. But I think it goes deeper than that, and shame, the concept of shame really speaks to it. Shame isn't just kind of feeling bad about yourself, it's feeling that you're defective, right? That you're fundamentally broken, and that you are unworthy and undeserving and incapable of, of all the things. And that's a feeling that almost everybody, if not everybody I've ever worked with, reports having felt for as long as they can remember. This isn't something that comes on when somebody becomes an adult. This is something that almost all of my patients can talk about having felt from the time they were 4, 5, 6 years old.
Mm. Yeah.
That's the eating disorder. That's what eventually turns into the eating disorder. Eating disorder behaviors might not come on until 10, 11, 12, 13, or something much later. But what's been there for a very long time is that really profound and painful sense of, there's just something wrong with me. I don't work, I don't fit, I don't belong, I'm broken, I'm defective, I'm not, as deserving of love as other people, I'm not as capable as other people. And that really is shame. That's sort of shame writ large, and it's shame that's really taken over somebody for any number of reasons.
Yeah, absolutely. How have you seen shame disproportionately then affect marginalized communities? And can you also, that is, it's a buzzword. Like, thankfully, we're talking more about this issue now, and we're talking more about diversity and inclusion, and
Mhm.
um, recognizing groups that have been oppressed or have suffered any number of um, manifestations of discrimination in a lot of different areas. But
Yeah.
when we say marginalized communities, what exactly are those? Can you give us some examples?
Yeah, so I think we're talking about um, sort of two different levels. I mean, I think being marginalized in a general sense societally, so I guess speaking from a sort of Western or even maybe a specifically American, you know, American context, to be the groups that are marginalized in this country are certainly immigrants, people of color, people in the LGBTQ community. I think arguably women are still very marginalized in some very profound ways. Really anything that kind of differs from whatever our understanding of what is kind of the norm. But anybody who's experienced systemic oppression, racism, sexism, homophobia, any of those, and classism, and I think that's one that often gets left out. Economic, there's economic diversity, body size diversity,
Yeah.
people in larger
Disability.
disability, absolutely. I think people in larger bodies that remains one of the last sort of truly acceptable prejudices,
Yeah.
unfortunately. But yes, absolutely, people with various levels of disability. So there are any number of things, but I think what all of those experiences have in common, and it's even in the meaning of the term to be marginalized, is that you're sort of set apart. You're not the normal. You're not sort of the default, right? You're something that's different in whatever way that you might be different. So it's both the whatever characteristic might set you apart, but then it's also more profoundly the repeated experiences of things like discrimination and um, um, being marginalized and not being able to fully participate fully participate in life the way that other people might be. That's kind of in a broader sense what we're
Yeah.
talking about
Yeah.
within the eating disorders community and within the eating disorder context and mental health, I suppose generally, where it's a little bit more specific because um, I think one of the most pernicious myths about eating disorders is that, eating disorder just means, you're white, anorexic, kind of privileged, um, young girl or young adult woman, right? That's if you think about most magazine articles or TV shows about eating disorders, that's kind of the standard picture. And by no means is that even the most common presentation of an eating disorder. And I think that's unfortunately something we're only recently starting to fully understand, both in terms of the available data, which are quite clear that, for example, women of color are at the same or higher risk of developing anorexia, bulimia, nervosa, and binge eating disorder.
Yeah.
That's not something that most people would have guessed if you didn't actually know the data. Um, and that rates of eating disorders in men are much higher than most people think it is, and that the most common um, and that there's no way to look at somebody and tell whether or not they have an eating disorder. I think it's all of these things kind of coming together that have unfortunately set the stage within our world, within the eating disorders world, where a lot of people who are struggling with this extraordinarily painful and debilitating illness aren't being recognized, aren't being treated, certainly, and aren't getting the kind of understanding and care that they obviously deserve as much as anybody else.
Yeah, absolutely. So much truth there. We've got a couple people that have good comments and questions. Phoenix says, "Hi, Kirsten. First time I've tuned in. Totally resonate with this. Shame is like a dark shadow that poisons your soul. LGBT issues definitely contributed to my anorexia." And thank you, Phoenix, for sharing and for being here. And I'm glad this is resonating. And I know it will continue to because we've got more and more things to talk about. Wendy says, "How do you suggest people with eating disorders and larger bodies, as you mentioned, approach medical providers who insist they lose weight to solve their medical ailments, especially those with atypical anorexia?" And that's a great question. And I was going to ask you it later, but you can answer, Wendy, right now if you want, Dr. Kim.
Sure, gosh, that's such a unfortunately common experience that so many people have. And I think like most of us in the field, we probably both belong to a lot of the same like Facebook groups and whatnot. And I feel like almost every day this some version of this question gets asked. You know, in within the sort of minority mental health kind of community, um, I think it's not exactly a split, but I think there's two kinds of feelings. One is that, you know, one is about educating yourself and working to educate other people, which I think is really laudable. But I think there's an equally valid um, standpoint, which is that's not my job to educate anybody because they should be they should understand these things because they're a medical professional and they should therefore be understand what that message is so incorrect, but also what it does to me psychologically to hear that message over and over again. And I think we kind of have to do both. So one answer I have for that is I think there have been wonderful organizations like Health at Every Size, and to find a to it can be challenging, especially if you're not in a major metropolitan area. But there are Health at Every Size practitioners, medical practitioners, therapists, dietitians who subscribe to the Health at Every Size approach. And I think that's probably the most direct way. But I also understand that not everyone has access to um, those kinds of practitioners, unfortunately. Um, I think the other thing, unfortunately, you might have to do is educate yourself and to not be afraid to ask questions. I think, generally speaking, in healthcare, most of us don't really shop for healthcare providers in the same way that we probably shop for most things. I mean, if I buy like new headphones for my stupid iPhone, I'm doing hours of research online, right? For even the smallest thing. And we really ought to be doing that for our providers as well. We don't have a system to really effectively do that. Um, but that would be another place to start. To come in with a set of questions to um, ask those questions and be willing to go find somebody else. Understanding that it might be frustrating and disheartening, but there are people I think um, who are willing to
Sorry.
um, become
Hey,
educated themselves.
sorry everyone, my phone is ringing. Hey, stop it. Real life. I don't know why it's not. Okay, we're gonna listen to my beautiful ringtone for 2 more seconds until it stops. There we go. Okay, sorry everyone. Um, imperfection is a beautiful thing.
That's right.
But no, really, really wonderful advice, and thank you, Wendy, for asking that. It's a really good question, and I know probably some other people who are listening were probably thinking the same thing. Um, and Queenish we've got great questions coming in. Queenish says, this resonates with me also. I've been in residential a few times. It's not easy and I struggle. I've been treated with a totally different approach as my peers. When I've advocated for myself, I'm shunned.
Yeah.
Yeah, yeah. I mean, I would, before you just have a hop in, Dr. Kim, I just want to say, Queenish, I'm so, so sorry that you've had that experience. And she says, and I'm the only Black woman in treatment. I'm so sorry you've had that experience. And
Yeah.
yeah, go ahead.
No, I mean, I think that's again, unfortunately, a very common experience for a lot of folks. I mean, I think this is something that almost any woman can certainly relate to, right? If men can men can be aggressive and assertive, and that's seen generally speaking as a positive thing. But if you're a
That's a great
woman and
point.
you do it, you're that's not necessarily seen as a positive thing. Um, if you're a black woman, even more so, because it feeds into all of these really pernicious stereotypes and automatic judgments that people make. Um, uh, the other systemic change that we really need to work on within the mental health world generally is the lack of diversity among professionals, and this is one of those places where it really, there's good intention on the one hand, but then um, part of the part of the systemic change that needs to happen is that more there do need to be more practitioners who come from life experiences that are just varied in all sorts of ways to be able to help provide adequate culturally competent services to people. And I think it's one of the big challenges in our field as to how to do it. I think people are very well intentioned in understanding it's an issue and wanting to do something about it, but until we make some pretty significant changes, I think it's unfortunately going to remain the case. And that doesn't mean that only a Black therapist is capable of treating a Black patient, or an Asian therapist needs to be the one to treat an Asian patient. It does mean that if you have some life experience where you understand the effects of daily microaggressions and what that does to you, I think it does change your experience of it changes your experience, and it changes your framework and how you look at things. And that's such an important part of anyone who's felt marginalized and who's been discriminated against.
Yeah. And I would just add that it just community is so, so important. And I think it's important for Queenish and Phoenix and Wendy, who wrote and things like that, is that you're not alone. Like, my heart breaks for the way that you've had bad experiences in treatment or with certain professionals, but I just want you to know that you're not alone, and that there are other people like you who have struggled and gone through this and walked through this. And so I would encourage you too to do that research or ask around about support groups for people that are like you and have experienced the same thing, and who might also be a part of the LGBT community, or also a man or woman of color, or a middle-aged woman with an eating disorder who's like, I'm in treatment with all these 16-year-olds, and how does this work? That search out, like on obviously social media can be crap, but social media can also be great because we're here and we're all here together. So there are those communities of support that are available. So reach out. Don't be afraid to reach out, because there are other people out there like you that are going through this, and also might have tips for ways that they've advocated and seen good results as well. But just know that, like, you're not alone in this. I just want you to know and hear that. So I was going to ask you about how to advocate for yourself, but we just covered that topic pretty well. How can we, and I'm sure then this is kind of your chance to encourage, how can we help reduce the stigma and shame for people who might be in these communities and have bad experience in treatment, so that they get the help that they need? Because I think also in certain communities, there's this perception, well, no, Latino women don't get eating disorders, or they're just all curvy. There's certain body images that belong to certain, ethnicities or racial groups or things like that. They're like, oh, all Black women look like this, or all Latino women or men look like this, or, it's just, how do we help change minds about, like, well, no, not all. And yeah, I suffer from this too, and I deserve care. Like, how do we start to break down those barriers and that stigma?
Yeah, I think there's, the real answer to that is anything and everything, right? I think it has to be there's some fundamental level of changing our dialogue about and understanding of what an eating disorder is. I think the more we focus on thinness, for example, which is certainly an aspect of what drives an eating disorder, but it is not by any means the defining characteristic of it, right? I can never remember who to attribute this to, but it's something I say all the time in my presentations, that eating disorders are not about wanting to look a particular way. They're about wanting to be better, because it's coming from this sense of brokenness and defectiveness, and what we've been talking in the context of what we've been talking about, this sense of shame. And if you understand it as something rooted in shame and rooted in anxiety, and understand the larger context of eating disorders, then it doesn't make sense anymore to talk about some of the examples you gave, which is, I mean, even when I was in grad school, which admittedly was a really long time ago, those were absolutely the things that I was learning, that Black women suffer from eating disorders to the same degree because of the types of bodies that were deemed attractive, because the assumption was that this disorder was coming from a sense of wanting to have a particular kind of body. And even when that's the case, that's not the core of what this illness is, right? So I think the more we can spread the message about what the larger context of this illness is, I've been a big advocate, frankly, of just the fact that we call them eating disorders really, in so many ways, puts the focus on the wrong part of the illness.
Yeah.
It doesn't do justice to the level of pain and suffering um, that people who struggle with eating disorders feel, and the level of fear and shame that that person feels. So without being able to sort of fiat the renaming of this illness, I think it's broadening our understanding about what it is. And once we do that, I think it just doesn't make any sense to think about it as affecting only one group or another group.
Yeah,
I think
absolutely.
that's one big part of it. I think certainly us as professionals need to continue to educate ourselves and broaden our understanding,
Mhm.
and add to our toolkits of making sure we're providing we're providing culturally competent treatment, but also treatment that comes from some level of a social justice understanding or social justice lens, because so many of these issues um, are at play in one way or another with this illness. Um, and I think, and then some of the systemic changes that we've already touched on a little bit. I'm um, terribly proud that our leadership team is 60% minority of one kind or another. I think that is a real rarity when I think about most programs. And again, in and of itself doesn't mean anything, maybe not, but I think there's there is importance to that. I think a lot of the people that have been writing in, um, part of the experience of walking into treatment when you're feeling so vulnerable and so raw and so not understood by anybody. And when you walk into treatment and there's something about you that automatically makes you stand out, even from these other people who are supposedly struggling with the same thing that you're struggling from. And from the get go, you can't feel a sense of like, oh, someone's going to get me here.
Yeah.
That only further serves to marginalize you and sends you deeper internally, instead of giving you some sense of safety enough that you can share whatever it is you need to share.
Yeah, absolutely. We got a great question from Becca. She says, Dr. Kim, do you think that fear is different from fear comes from shame, or are they
Mm.
different emotions or feelings? Um, would you see an abused person as a marginalized community? Thank you for helping me understand.
Gosh, that's a great question. The first part is a lot easier to answer. I think fear and shame are related, but they're pretty different. I think, and when I say I think if we broaden fear to fear and anxiety, there's a lot of similarities in that they're both very adaptive qualities, and they're really two of the key qualities that have allowed us to survive as a species. And so, because we're so, in terms of our evolutionary history, we're still pretty young. All of the circuitry in our brains that wired us for propensity for shame and wired us for propensity for anxiety still are they are very much in effect and very much in control of how we operate. um, so both have those in common. They're both really sort of primal emotions or primal experiences that we can have that are often very unconscious. So there's a lot of similarities in that way, but they're pretty different. I think what we're understanding about the neurobiology, to the extent that we can understand it, they're somewhat different, and the way that they manifest can be quite different. Eating disorder serves as one point of commonality, though, because all eating disorders are based in anxiety and fear, and all eating disorders are based in shame. Um, and um, and so in that way, they're both really potent um, potent characteristics of the experience of an eating disorder in particular.
Yeah. And I would say about the abuse question, I would say
Oh yeah.
I was thinking as you were talking about fear, and I would think that if someone has been abused, that they're obviously they've experienced trauma, which
Mhm.
then creates a lot of fear, but then trauma also creates shame. So I kind of see the layering of what she's getting at there. But then would abuse or trauma also be a marginalized community? I'm not sure. That's a question that you can answer.
Yeah, um, I think there. I think the tremendous amount of shame that most people who've been who are survivors of abuse feel as just part of that traumatic experience. I think that automatically puts it somewhere in that camp. And there's certainly, it's not something that is okay to talk about, generally speaking, right? Most people certainly don't understand it. It's not something that is well understood. I think there's still the stigma of you could have just left,
Yeah,
right? Why
yeah.
didn't you just leave? Um, I think all of that um, certainly serves to there's a lot of commonalities in that experience and other stigmatized experiences. Absolutely.
Yeah. So this has been an amazing conversation. And thank all of you so much for sharing your hearts and pouring out your stories. And it's so neat to see you encouraging each other and finding a community here. But two last quick questions for you, Dr. Kim. You've been so generous with your time. The first is, how would you encourage a parent or a loved one of someone who might be at one of the intersection of these communities that we've talked about? How would you encourage that parent or loved one to support this person in recovery?
Yeah. So I think there's all of the kind of normal things that probably we all say. Obviously, listening without judgment is really important. Um, Asking questions more about someone's experience as opposed to like why questions, which can sometimes feel accusatory. I
Mhm.
think all of those things are super important. I guess the one thing I might say is, I spend a lot of time on planes, and we use this analogy all the time. But like when they go through the safety announcements on planes, they always say, if you're traveling with a child, you've got to put your mask on first, right? Now, I'm a new parent. I have a 2-year old and a 2-week old, and it's hard. It's really hard to imagine doing that. Intellectually, I absolutely get it. Right? I get the importance of if you're gasping for breath, you're of no use to your kid. So I fully understand the importance of it. But we do use that analogy quite a lot because I think that's something that may not be as obvious. An action that a loved one or a family member can take. But sometimes, doing your own work, being in your own therapy itself can send a powerful message to your loved one that you're willing to, do difficult work, that you're also willing to do something that might be stigmatized, and that if you're doing this work, that maybe you might be able to better understand what your loved one is also going through. I think it sends an important destigmatizing, normalizing message, and I think that can be a really powerful. There can be a lot of powerful meaning in doing something like that as a supportive act, but it's also something to take care of yourself because again, I do think there's a lot of truth to that. If you're not taking care of yourself, there's it's hard to really be taking care of and providing support to your loved one.
Absolutely. And last question is for those who are watching and maybe watching later on our YouTube channel. How would you encourage someone who is in a difficult spot right now? What would you say to motivate them to keep going?
Yeah, I was trying to think about like non-cliche things, but I think the what we've come to understand about eating disorders is that um, recovery is absolutely possible, um, and it's something that is very, very treatable. It might take a long time, which it unfortunately does for some people. It's undoubtedly going to be a very painful process, but recovery is absolutely possible. And I think a lot about, the myth of Pandora's box, right? We've kind of taken that story to mean more about the if you look too hard at something, or if you ask too many questions, you're going to open up Pandora's box and all this bad stuff is going to come out. But the actual myth, that's not where the actual myth ends. The actual myth ends with at the bottom of all of that, where all the evils of the world have come out, what was left inside of that box or that jar in the story was hope.
Mhm.
And that's really the message of Pandora's box, is that if we're so afraid of all the stuff coming up and stuff coming out that we close the box, what we're really closing up is hope.
Yeah,
And you have to have, I suppose, some amount of faith that if you endure all of this, all of the bad, that what's going to be left in there somewhere is going to be hope. And that's absolutely been my experience as a clinician. Is that after through going through all of that hard work, I've seen so many people just thrive, and so many people be able to do things they never thought they'd be able to do. Um, but it takes a tremendous amount of courage to go through all of that.
absolutely. Well, thank you so much. We will leave it on that note because it's just full of so much truth. And thank you so much for your wise words for all of our viewers and for me too. I like listening to you.
Well, thank you.
Of course, yeah. So thank all of you so much for watching. Me and Elsa wish you a lovely evening with her little tongue hanging out. For those of you who are just tuning in for the first time, Elsa's old and she doesn't have any more teeth to hold her tongue in. So that's why it hangs out. But she doesn't care what anybody else thinks. She's just her and she's happy. Just like I hope all of you can find some peace in your heart tonight, knowing that you are enough just the way that you are and that you're not alone. So, my last thing I want to say is just if this was meaningful to you, if it could be helpful to someone else in your community that you might know who's going through the same thing, or a parent or a spouse or a loved one you know who's trying to support someone, they want to understand more, please share this resource. It will be on our videos page here on our Facebook page, as well as posted to our Eating Disorder Hope YouTube channel. So you can head over there, subscribe to our channel, and see all of our past Weekly Hope episodes, but also you can share the link to this one as well. We just want to make sure that the message gets out, that we learn how to be our own advocates, and we also are a part of creating the systemic change that Dr. Kim talked about, so that more people can get the care that they need and deserve. So we'll be back in 2 weeks on December 4th for another episode of Weekly Hope. Stay tuned to our social media channels to learn more about that. But just want to say bye, Becca, Queenish, Wendy, Phoenix, all of you beautiful people. We'll see you guys in a couple weeks. So have a nice night.